Good afternoon, everyone. Happy Thursday. I'm Michael McNutt, WEDI's Director of Events and Education, and welcome to our 2023 WEDI Workgroup and Subworkgroup Open House. Before we begin, a couple of quick words regarding WEDI. And many of you all might know this, but some of you might not, so welcome. Formed in 1991 by then Secretary of the U.S. Department of Health and Human Services, Dr. Louis Sullivan. WEDI is the foremost authority on health IT guidance. Named in the HIPAA Act of 1996 as an advisor to the Secretary of HHS, productive working relationship with several elements within HHS, including CMS, OCR, and ONC. Today's focus is on our health IT focused work group, task groups, and sub work groups. Our role: convene, collaborate, educate, and influence. Now, how do we do that exactly? Well, you're going to see one of our examples today through our work groups and sub-work groups, also through our task groups, open public forums, our conferences, by the way, our spring conference is next week, forums and virtual spotlights, our branding for webinars, our podcast, The Collective Voice of Health IT, and our member position advisory events. As you can see, not only on this slide, but through the speakers and who they represent today, WEDI members represent every facet of the nation's healthcare industry, including practitioners, hospitals, plans, government entities, vendors, and more. WEDI's mission overall is an industry convener to bring multi-stakeholder leaders such as yourselves in terms of guidance of the nation's healthcare system, how to use and leverage industry's collective technology, knowledge, expertise, and information resources to improve healthcare, improve administrative efficiency, quality, and cost effectiveness. Learn more about us and become a member if you're not already at wedi.org. Now, today we are focusing on our work groups and sub-work groups. And at this time, it's my pleasure to introduce the WEDI Workgroup Leadership Co-Chair from PNC Bank, Pam Grosset.
Thanks, Michael. Can you hear me okay?
Perfect.
Great, thanks. Well, welcome everyone, and thanks for attending today. We wanted to take the opportunity to share some information about one of the biggest parts of WEDI and one of the biggest benefits that you have as a member if you are a member. Our WEDI work groups are one of the biggest ways that we achieve the goals that WEDI has. So as you can see here, every day our WEDI members volunteer their time and talent to our work groups, and our focus is providing thoughtful leadership and common sense approaches. And we're really looking at enhancing the exchange of clinical and administrative healthcare administration. So our work groups collaborate to collect input, exchange ideas, and make recommendations for best practices that inspire impactful and far-reaching change in the healthcare industry. So we have a multi-stakeholder approach where we bring everybody together and discuss whatever challenges might be occurring, whether it be an operational challenge, implementation challenges, different things that occur, and discuss what information we can share about that and potentially identify some best practices that help overcome those challenges. As I mentioned, participation in the work groups is a benefit for WEDI members. So if you're not a member but are interested, please contact Bill Allder, and here's his information, or you can go to wedi.org. And if you are a WEDI member and you see some information today that piques your interest and makes you want to join a work group, please contact Samantha Holby, and here's her information. The WEDI work group leadership is sort of provides oversight to all the work groups and sub-work groups that we have. So again, I am a co-chair, Pam Grosset, and our other co-chair is Mary Lee Stein with Aetna. And we have almost all of our work groups participating today, sharing information about what's happening in their group. If you'll go to the next slide, please. So just to share a little bit of information as we mentioned the terms work group and sub-work group, I just wanted to share here's really what we're talking about there. So I mentioned our work group leadership committee provides oversight to all of our work groups and sub-work groups. And then there are quite a few of those that report up to work group leadership. We have security and privacy. So we have a work group level, as you can see in orange. That's kind of a higher level group. So we have security and privacy, health equity, payment models, telehealth, and genomics, all at the work group level. We have a task group, which is more, it acts like a work group, but is a little bit shorter term. And so we have a task group that focuses on the No Surprises Act. And then we also have a work group that focuses on the processes around data exchange. So there are a lot of different kinds of data exchange. So under that work group, then we have sub-work groups that focus on the different business processes for which we're exchanging data. So acknowledgments, attachments, property and casualty, claims, claim status, remittance advice and payment, dental, eligibility and benefits, prior auth, provider information, and emerging technologies. So this kind of demonstrates when we're talking about work groups and then sub-work groups, what that means just in terms of the hierarchy. They function the same way, but the sub-work groups have just a little bit more granular focus because they're looking at a specific business process. So if you go to the next slide, please. So if you do have questions that you'd like to ask any of our presenters, please just ask them in the chat that you'll see as part of your Zoom taskbar. And we do want to let you know that the slides and recordings will be emailed out after the event. So now I will turn it over to Michael Patwell of the Payment Models Work Group to kick us off. Michael?
Great. Thank you, Pam. Starting a clock here. I don't want to go over my time, but welcome everybody. My name is Michael Powell. I work for EDIFX as a principal business advisor. Fortunate enough to be the chair of the Payment Models Work Group. But this work group has been around for almost a decade now. So we've done a lot of work and we'll go through some of that right now. If you just go to the next slide. So if you give me 3 more clicks, Michael. So the Payment Models Work Group, our charter was to go out and look and identify technology attributes, look across the industry, whether it's Medicaid, Medicare, commercial, and look at, what we could do to either 2 more clicks, either educate or advise, right? So across multiple business uses, whether it's regulatory changes from CMS or CMMI or many different Medicaid states also are individually bringing value-based care and payment models to their MCOs and CCOs in some states. But we primarily look at the interoperability, the standards, the compliance. We work hand in hand with CAQH and Da Vinci. So it's a great model for everybody to either contribute from either a payer or a provider and other vendors. It's just a great work group. So go to the next slide, please. So previously, we've presented a white paper. We created the white paper, published it, and then followed it up with a webinar on the topic. So you can see the questions to the left. I won't read those. But we're really going after a 101. And off to the right, you can see the healthcare payment learning and action network advanced or alternate payment models framework. We started with that. We didn't really, stray outside of that framework where they identify category 2, 3, and 4 are certain types of models, certain type of payment models. So great white paper. We wanted to take that to the next level. So if you can go to the next slide. What we did was we proposed and were approved by the WEDI board to move forward with a volume 2. So we're actually going a little bit deeper, maybe the 102 version of this. So we're going to look not only at simple models, but also the more complex. If you can go to the next slide, you can see that we'll just have an opening, and like the first white paper, we feel it's important to start with definitions. So we'll have definitions that are general, and then definitions of the models, and then also some of the payment streams. We've been finding through our collaboration with payers and providers that there's not just one model, right? There's a model and that could have multiple payment streams under that. So we're going to do our best to lay out those definitions. And then we're going to take a look back. We'll look back at the earlier payment models and see, what was done before. We'll look at the current models and how they're kind of changing. There's a lot of collaboration with another work group called Health Equity. A lot of the models that are coming out, whether it's from CMMI or from the state Medicaid, are using health equity as certain levers within to see if they can advance the value outcomes from payment models with providers and ACOs and hospital systems. And then we'll look, maybe at some of the designs, the various designs, as I mentioned, the payment streams, and then possibly, we're not sure yet, we're still discussing this as of last month, we're going to maybe wrap up on what our assumptions are on future models. Next slide, please. And here's that modified. So when I showed you earlier the Healthcare Payment Learning and Action Network, which I believe next week we're going to have the two co-chairs from their health equity advisory team speaking next week. We took a chance at looking at let's adapt it, right? So it's adapted. It's not what you saw before when we had the first white paper. We tried to look at where's the provider risk, where is some of the struggles, the complexities that are impeding the whole healthcare industry moving to value-based care over fee-for-service. So we'll look to push that out, bring some more education to those risk levels. And that's the goal of the white paper. And hopefully we'll follow that up with a webinar or a spotlight, possibly in the fall national conference. Next slide, just a quick commercial on Let's Join us. We're on every fourth Tuesday of the month from 3 to 4. We'd love to have you join us. And I did that in under 5 minutes. Thank you, Michael.
Thanks, Michael. And just a reminder, if you do have questions, please type those in the chat. Now I'll turn it over to Sherry Wilson and Tina Green, representing our Property and Casualty e-bill subwork group.
Thanks, Pam. Welcome, everyone, to our Property and Casualty e-bill subwork group showcase. First, we're going to give you a quick overview of our purpose and scope. We will then display one of our work products available to members and then wrap up with a few items we are currently working on. Next slide. So the purpose of our subwork group is to collaborate with regulators, insurers, and other entities proposing and facilitating implementation strategies that will satisfy jurisdictional regulatory requirements. We promote alignment with HIPAA transactions and code sets, as well as the IIBC guidelines. We are also always on the lookout for any stakeholder business needs or issues to provide guidance and to create education materials to assist with implementing. And to review our scope real quick, responsibilities are to adhere to WEDI policies and procedures and support the industry by developing educational material. Our primary goals to provide a forum where we can address business issues related to developing e-bill transactions and provide educational guidance and best practices for any issues related to business processes and any challenges. Real quick, Michael, can you show us the spreadsheet? We don't see it. Okay, there we go. So here is one of our current products. We've had it out there for a while. It is a living document. So it will be changing as regulations change, as they are implemented, as they are updated. So if you'll see here, our first tab, summary of e-bill states, just real quick glance at, which states are IIBC guidelines and then some effective dates. Michael, if you could go to the event table tab. And real quick, if you could scroll to row 8 and 9, I just was going to point out, and you might need to slide that bottom, the bottom to the very left, far left. There we go. So for instance, our event table here, payer e-bill payment timeline. So this takes you across for each one of the states. We will get that freeze pane fixed at the top of the spreadsheet. So it's kind of a quick go-to. Oh, okay, California, 15-day uncontested. And then you just move right on over to Texas. Texas is 45. And then we have like remittance advice timeline. So this is the timeline for each of those states. And then real quick, Michael, if you'll go to the e-bill formats tab. This is just kind of a real quick glance, has everything right there in place as to which form types are used. There's some more information on that tab. And then the last one, the summary e-bill rules. and this is another great one. So we've got all of the websites listed, the URLs, and gives you the actual statutory reference and administrative rule references, as well as some other valuable information. So with that, I'm going to turn it over to Sherry, who is going to give us an update on what we are currently working on. Sherry?
Great. I'm going to wait for Michael real quick. There are really three main projects that we're working on. One is there we go, and one more over. Great. So 3 projects, and one is Property and Casualty Code Usage Guidelines for Healthcare Payment. And this is very similar to CAQH Core business use case scenarios for the usage of CARC and work codes. In property and casualty, there's a lack of standards. So the value of this guidelines that we're working on will allow payers and states to have a more specific standardization on the use of the code set. So we're really excited about that. The second project we're working on is prior authorization, looking at property and casualty business use case scenarios for the states. Today, states are, there's a lot of paper, fax, and forms, and not really using like the 278. So there's an opportunity, states are asking the work group to look at talking points. So as a reference for legislative and rulemaking process, and again, the value impact to the industry is that whether you're doing property casualty, commercial, or government, to have one standardization across all lines of business. And then the third project we're working on is the upcoming July 26th Property and Casualty podcast. Great opportunity to learn about upcoming state regulations and stakeholder compliance impact. And we'll also be sharing with you 6 key strategies to increase first-time property and casualty bill submission, and this includes acknowledgments and electronic attachments. So great opportunity to learn more about information regarding property and casualty. And next slide. And to join our work group, we really like to invite you. It's a great work group. We have states, payers, providers, third-party vendors, everyone participates. So we meet the first Thursday of the month, and if you're interested in joining, please contact Samantha. So thank you.
Thanks, Sherry. Thanks, Tina. Now we'll turn it over to Sherry, Randy, and Ed for the Emerging Technologies subwork group.
Yeah, thank you, Pam. I think I'm speaking on behalf of Emerging Technology. So if you can advance to the next slide, appreciate it. So we like to think we're the cool group. We're focused on emerging technology, including AI type stuff like machine learning, natural language processing, Firebase clinical exchange, robotic process automation, and anything related to regulations related to technology. Certainly lots of focus on security technologies and others that are of interest to the members, like ChatGPT. Our scope for our subwork group is to be technology vendor solution agnostic. So we're not promoting any vendors and trying to tone down any of that talk. We will work, and we do work with other work groups or subwork groups to make sure that we pass on anything that impacts them. So for example, prior authorization proposed rule has FHIR APIs, and so we're working with that team. Working with the attachment team, for example, as well for some of the clinical exchange, and there'll be other areas as well. Next slide, please. So recent products this year, we've had a focus on setting up a FHIR server. We had someone from Optum talk about what it was like to set it up, lessons learned, some of the successful practices going forward. It was highly attended, and it was so popular, we're bringing that person back for our education committee discussions on spring forum. ChatGPT is something we just started off last month. We had a lawyer talking through ChatGPT and what it is and some of the business challenges. Today we'll have Sutherland Group will be presenting their AI team we'll be talking about ChatGPT and some of the applications for just general applications and certainly healthcare applications as well. So that will be today at 3 o'clock. So if you're not part of that, I don't have that invite, please reach out to Sam so that you can come and join us. And we're really excited. We're working with a professor who is John Halamka recommended this professor from Carnegie Mellon. That's an AI professor. So we're really excited about inviting him for session, hopefully in June, maybe July timeframe. Next slide. And some of the other things that we're cooking up, we have a really cool application on natural language processing for images to help automate prior authorization decisions. So that should be really interesting how they were able to derive meaningful input and to be able to automate decision process in real time for prior auth. We're also talking about some of the friction points and related to industry adoption of regulations. Sorry, we have an extra adoption thing there. And then successful practices on actually fire type successful practices and clinical exchange as well. So please join us, and we always were looking at people who are doing cool things. So the co-chairs would love to hear some of those because we can highlight you in our presentations. Thank you, and we'll move on to the next topic.
Thanks, Ed.
Actually, before we move on, Ed, you do have a question in the chat from Janice. Has there been any consideration of starting a separate AI, ML, NLP work group?
Janice, let's talk. That is very interesting. There has not been a discussion, but it's a very interesting topic. I'd love to explore more.
All right, then we'll move on to our health equity work group with Christy, Mark, Linda, and Nancy.
Hey everyone, welcome. This is Linda Rowe, and give you a little bit of an overview on our health equity work group. We're one of the newer work groups. We've been going for, I want to say, about a year plus now. So what our work group is about, because this is such an important and very active topic in the health domain right now, we brought together this group to just create a forum to discuss health equity, social determinants of health, and how we can improve that through technology for healthcare delivery. Thinking about not just the sort of technical aspects of capturing the data, but how do we impact processes, workflows, and using that data to make informed choice and decision about how we integrate health equity into, all our different care delivery, payment, et cetera. We're looking at some business cases. Is there a return on investment for data exchange and improving, health equity? We're trying to be multi-perspective, so providers, payers, vendors, individuals, and population. So our work group has a huge number of different perspectives that come to the table. And again, we want people to really understand the impact of social determinants on health equity. So what we're trying to look at right now is sort of some business cases, and we've been doing that, and you'll see in the next slide, mostly through presentations. We haven't really talked a lot about ROI, but I think that's an important thing. We've talked quite a bit about exchange and how that plays an impact. And I think we've had a few folks talk about the impact sort of upstream and downstream in the care delivery processes. Next slide, please. So our first deliverable was actually just coming up with a terminology white paper. And again, there are so many different terms that people use for different aspects of describing health equity and social determinant. And I don't know that the group picked, I wouldn't say there's a right answer, but we tried to sort of look at for each definition a sort of a comprehensive, already defined, so meaning comes from, the CDC or World Health Organization. So we're adopting somebody else's sort of definition. So we looked at a number of those. So that's a white paper. Like I said, we've had a number of presentations. So we've talked about had two of our national HIEs talk about how to integrate social determinants of health into provider workflows. You know, both Todd and Nick from HealthX and Greater Houston Health Connect came and talked about how they're using referrals with community-based organizations. At our last meeting, Russ Leftwich, clinician informaticist, talked about ontologies and vocabularies around social determinants, because this is still a big issue. I know that the Gravity Project is trying to address this, that CMS is grappling with this, just on how to think about their different reporting programs. ONC is trying to bake into a lot of their programs, you know, health equity by design, and across many organizations. But there still is this challenge around ontologies and vocabularies. Angie Bass talked about health data utilities, how they're a little different than just being an HIE, because HIEs are sort of morphing and expanding and really redefining how they're thinking about providing value to their constituents, including incorporation of SDOH. And then again, we had our last talk was Kendall Whitlock talking about sort of clinical trials and how Walgreens is thinking about, again, health equity when they do that. We had a spotlight event last year, earlier this year, that was quite successful. It was about 2 3/4 day content, had great speakers with lots of great insight on the topic. Next slide, please. And then finally, you know, we continue to look for speakers, for people who are versed in this or have a perspective. And we're also going to dig into this ontologies and vocabularies that I just talked about, that Dr. Leftwich covered with us at our last work group meeting. I want to thank my other co-chairs, Nancy, Mark, and Christy, for their ongoing support. We would love to have more participants and more contributions to our work group. I know some folks love to just sit in and listen and sort of learn, which is great, but we also want folks to join who have a perspective, who've actually worked with SDOH data or have worked with health equity in their organizations, and come participate, present, and be an active member of our work group. So we meet the 4th Thursdays at 2 p.m. Eastern. So happy to have folks come and join us.
Thanks, Linda. Now we'll turn it over to Mary Lynn, Derwin, Rose, and Susan for our attachments subwork group.
Again, welcome to the WEDI Workgroup Open House. We're happy to join today to provide an overview of the attachment subwork group. Our co-chairs are Mary Lynn Bushman of Elevance Health in NGS, Derwin Day of HCSC, Rose Hodges of Aetna, and myself, Susan Langford of Blue Cross Blue Shield of Tennessee. I'll now turn it over to Rose Hodges to begin the overview.
Sure, thanks, Susan. Okay, the purpose of our subwork group, the attachment subwork group, is to focus primarily on healthcare business processes and challenges related to workflow for attachments, promote adoption of electronic transactions for attachments, educate the industry on attachments, provide possible implementation approaches, and to assist with adoption of the new attachments final rules. Address attachments, which will include claim attachments, prior authorization attachments, as well as other additional information needs. And with that, I will turn it over to Derwin Day, who will go over the scope.
Hi, thanks, Rose. The attachment in Rose's last bullet there is very important one, because attachments is really about additional information. Anyway, we adhere to all WEDI policies and procedures. We report up to the workgroup leadership monthly using the appropriate templates, and Susan makes sure that we do that every month. Thank you, Susan. We actually had a meeting yesterday that we hadn't had in a while, but we actually made a little suggestion of changing this next bullet, being standard and technology vendor solution agnostic was the suggestion. So we will work on changing that. And then participating in WEDI's activities in providing input to CMS, HHS, ONC as appropriate. Mary Lynn will talk a little deeper about that in the next coming up slides. So our primary goals for attachments are to for us to really have a forum for all stakeholders to address those issues around using attachments. I'm not seeing the bottom of this. And we want to, of course, be a vehicle for the education and guidance on best practices on how to best use attachments. And we do provide feedback, not just to CMS, HHS, and ONC, but to the SDOs as well, as needed. And as I said, I turn this over now to Mary Lynn to talk about what we're doing in the work group.
Thanks, Derwin. So over the past year, we really haven't met at all. And that's because, of course, there was no regulation for electronic attachment. So we really didn't have anything going on. But as everybody's probably aware, the electronic attachment NPRM was issued in late December. So we did begin meeting early 2023 to talk about the NPRM. Next slide, please. So what we're currently working on, right, we talked about the NPRM comments, we participated in the WEDI MPA, all those comments were submitted to CMS back in April, but we are still meeting, and we're meeting, and we're still talking about the standards that were named in the NPRM and just having some discussions. There's been questions and things like that. So we're still moving forward with meeting and talking about the electronic attachment NPRM, and we're waiting for that final rule, right? So when that final rule comes out, then we'll start to discuss implementation approaches and some possible white papers. But we really can't move forward with any of those until that final rule comes out. We don't want to issue any kind of white paper that is not in line with what's going to be named in the final rule. And of course, none of us have that any idea what's going to be named in that final rule right now. So we'd love to have your participation in our group so that we can continue these discussions. So I'll turn it back over to Susan.
Okay, next slide, please. Okay, as has been mentioned, the attachment subwork group has started meeting again. We meet each month on the third Wednesday at 3 p.m. Eastern. So please join us. We'll be happy to have everyone.
Thanks, everyone. And so now I'll turn it over to Jessica and Tara for the Acknowledgments subwork group.
Thank you. This is Jessica. Tara was unable to join us today, so you get me. So just an overview of our work group. We focus on business processes and challenges around acknowledgments to try to develop guidance in support of the industry and promote adopting all electronic acknowledgement transactions. Our responsibilities are to adhere to WEDI policies and procedures, report to the work group leadership monthly, and be technology vendor and standard solution agnostic. Our goals are to provide a forum for our stakeholders for anything around attachments, challenges, issues, acknowledgements, challenges, issues, implementation, usage. We provide educational guidance and best practices for overcoming those barriers and challenges in the use of acknowledgements. We participate in WEDI's mission to provide input to CMS and HHS as appropriate. and encourage adoption of all acknowledgement transactions by identifying the ROI. Some recent work products is a Did You Know issue brief. And issue briefs are used to provide education related to the transactions within the EDI exchange using the 5010 technical reports and EDI standards. Our recent work product is a 999 implementation acknowledgement for healthcare insurance issue brief. And we are ready for intellectual property review and then publication on that issue brief. We're currently working on a new Did You Know issue brief on 824 application reporting for insurance. And we had written a previous issue brief, and so we are looking to just expand on that with more detail around the 824. And our last slide, our meeting date and time. We meet the first Wednesday of the month at 3 p.m. Eastern time, and our next meeting is June 7th of 2023. So please join us. We're always looking for input from all stakeholders.
Thanks, Jessica. Now I'll turn it over to Janice and Heather for our prior authorization subwork group.
Thanks so much, Pam. This is Heather McComas. I am one of the co-chairs of the prior authorization subwork group, along with Janice Bakos from Aetna. And you can go ahead to the next slide, please. Our work group, I think, has gotten a lot of interest in the past couple of years. I'm sure that many of you listening today are aware that prior authorization is a very hot topic of interest in the healthcare industry, both because of the burdens and administrative costs that pose across stakeholders, and also for concerns about the potential delays to patient care. So a lot of great discussion in our subwork group. From all sides. Our purpose, as you can see here on the slide, is to focus on business processes and challenges related to workflow for prior authorization, and then to develop guidance to support the industry in implementing a standardized and automated process to reduce administrative burdens and minimize patient care delays. I'm sure, as many of you are aware, that prior authorization, unfortunately, today is a very manual process, often involving use of phone calls and faxes. And so we are trying to create guidance that helps the industry move to an electronic process. And doing so to promote adoption of standard electronic transactions for prior authorization. For our scope, we provide a forum for all stakeholders to evaluate and address business issues and current workload challenges related to the implementation and the use of electronic prior authorization transactions. We provide educational guidance and best practices for overcoming barriers, challenges, and knowledge gaps related to automating prior authorization and maximizing the return on investment for all stakeholders. And as several of the other co-chairs have indicated, that we do participate in WEDI activities and providing input to the federal government as appropriate. I think a recent noteworthy example is there have been several notice of proposed rulemaking or NPRMs that have been out for comment early in 2023, and our subwork group members participated in some WEDI member policy advisory groups that informed WEDI's comment letters to the federal government on those proposed rulemaking by the federal government related to prior authorization. And I will turn it over to Janice for the rest of the deck. Thanks.
Great, next slide, please. So we're talking about our recent work products, and we have this prior authorization workflow barriers and guiding principles document. This was finalized, published, and available now on the WEDI website, effective with October 2021. So whether it's you consider that recent or not, it's a 20+ page document packed full of information. So that particular document is also something that we use today when we have new members to a group, and really just to share what's prior authorization and the entire what is the 278X12 suite of transactions. So it's got workflows, it's got definitions, and you can't even imagine how many different names there are for prior authorization and the varieties. So how does our work sessions, how do we function? So generally, we dedicate our time to a central activity. For example, the workflow guiding principles. And our sessions are attended by members from all sides of what we consider the triangle, and that's providers, vendors, and payers, and all are critical in making the flow of a single transaction successful. So again, the initial activity that we were directed to was by CMS asking the question, what are the challenges keeping 278 usage low? What are those challenges and how can they be addressed? And that's the result of the guidance principles document. And in there, we've gone through, I think there's 7 or 8 particular guiding principles, items that attendees thought, there's no solution for this. This is why I don't use the transaction. But what we found out was there are solutions. 278, again, isn't a single transaction. It's a suite of transactions. And by looking through that, especially, say, the inquiry transaction, which was our next document, solving problems, reducing phone calls. So our goal is really to select that single topic that we're going to discuss, research it, document it, publish the findings, and make it available on the WEDI website. So we move forward from the guiding principles that we had completed in 2021. And the group basically polls, gets ideas, what do they want to tackle next as their objective goal, what do they want to research. And the next thing turned out from the guiding principles document that the group would like to excuse me, work on the electronic inquiry transaction. So it's currently in final review. And again, the goal of this is, finding that there is a way to find out what the status of your pre-certification is other than staying on the telephone line. So moving forward, can we get the next slide, please? Looking at polling, we're at a kind of a critical time. We did take like 2 months. We were very fortunate to be able to use this time, the prior authorization time, and dedicate it to the rules that came out, and you've been hearing about them, for prior authorization and attachments for prior authorization, and to get people that are very knowledgeable in the industry to attend our session and to share that information and have, allow the group to ask questions. So not only is it an exchange of information, but guest speakers are always welcome. And right now we're at a crossroads where we're looking at, what do we want to dedicate time to? And you're hearing other groups saying, until the rule is final, we don't want to go there. And I guess that's where we are too. So we're looking at, we'd love to sink our teeth into attachments along with the attachments work group. We always have Ed Hafner, as you heard before, and he's always looking at, FHIR and other approaches in the industry to actually submitting those transactions, pre-certification transactions. So right now we're at a place where we're going to be polling and deciding where the group's going to go and where they're going to be putting their time into the next couple of months and what that initiative is. So if any of this sounds interesting to you, next slide, please. We meet on the third Wednesdays of the month from 1:30 to 2:30. If your schedule allows and this is something you'd be interested in, we invite you to please join us. Contact Sam and she'll get you the information you need to attend our session. Thank you.
And Janice, just to clarify, you said that you meet on the third Wednesday and your slide says Tuesday.
Oh, I'm sorry, Tuesday. Thank you.
Just wanted to make sure that was clear. Well, thanks. Thanks, Janice and Heather. And before we move on, I do just want to touch on one thing that Janice mentioned, and I mentioned it briefly earlier, but something that is part of the great value of our work groups and the brings value to our members as well as the industry as a whole is the fact that we as WEDI bring together all of the different stakeholders that are involved in the healthcare process. Excuse me. So we have both payers, providers, and vendors all participating in the discussions that we have in our work groups. So we get a variety of perspectives in our discussions, and it enables us to really talk about a topic from all of those different perspectives, bring in challenges that might occur from from a provider perspective that maybe only those from a payer perspective might not have realized, and then allow us to talk through that. So I just wanted to point out that's one of the really large areas of value that our work groups bring, is being able to have those discussions across the stakeholder groups and bring in all those different perspectives. So with that being said, I'll turn it over to our No Surprises Act work group, which co-chairs are Terry, Stanley, Tom, and Beth.
Yes, and this is Stanley Nachemson, one of the co-chairs of the No Surprises Act work group, which was put together fairly soon after the legislation, the No Surprises Act, was passed as part of a budget act. And with the recognition that there are quite a number of pieces in that have a direct impact on the industry and a lot of new processes that we needed to work through. Next slide, please. So what we do is review the legislative and regulatory requirements, try to identify those items that need more industry education and some work products to advise the industry. We work with some of the existing WEDI committees, for example, the claims work group. We work very directly with, since one of the processes, the good faith estimate, is very similar to a claim. We also collaborate with other outside groups. We've been spending a lot of time going back and forth with the Da Vinci Group that is developing the standards for the exchange of good faith estimate and the advanced explanation of benefits. Spent a lot of time trying to understand the requirements, work with the folks in our group to develop consensus-driven, we'll call them solutions. And I think what we really focus on is the business processes involved in the No Surprises Act. We know that there are a number of the committees, that the SDOs that are developing the potential electronic transactions to exchange the data, but we are working very much on the business processes, what data has to be collected, how it should be collected, and what needs to be put in place at providers and vendors and health plans to successfully accomplish the goals of the No Surprises Act. Next slide, please. We have assisted in developing the recommendations that WEDI has submitted to HHS and the rest of the government for the new approaches and the comments on the request for information that CMS issued. Also have published and created a couple of recommendation letters to the Secretary about how to implement the No Surprises Act, a glide path allowing the industry to slowly and correctly develop the necessary infrastructure to implement the requirements of the Act, and some additional letters on the No Surprises Act as to where the industry is and what needs to be done. Next slide, please. We are working on a white paper that is focused on the workflows and the information exchanges required for some of the price transparency provisions, how a convening provider and co-provider need to work together to develop the information and produce a good faith estimate, looking at the process for the uninsured and self-pay patients and creating a comprehensive good faith estimate, and then the process for creating both the GFE and the advanced explanation of benefits for insured patients. What we are identifying is the places where we need better guidance from CMS, as well as creating suggestions for that better guidance, looking at current business processes and determining how they need to be revised or new business processes need to be created, and continuing to give the regulators insight on how and when to implement the necessary parts of the law. Next slide, please. We meet every fourth Friday at not 4 p.m., but 1 p.m. Sorry, there's a mistake on that slide. 4 p.m. is a little late in the day on Friday, so we try and make it a little bit earlier. Again, the fourth Friday of every month at 1 o'clock. And we would love to have you join us. Again, there are a lot of moving parts in this law. We're tackling them sort of one by one, and it's interesting that as each time we identify an issue and sort of unpeel the onion, we discover 3 or 4 additional issues that need to be dealt with. So thank you very much. And again, if you have any comments, concerns, or want to join us, please contact Samantha and she will get you into our group.
Thanks, Stanley. So now I will turn it over to the claims subwork group, also with Stanley, but also Chuck and Beth.
Great. And I believe Beth is on personal, is not with us. I believe she's taking some time off this week. So we don't have the benefit of her expertise, but Chuck and I will handle what's going on in the claims subwork group. So Chuck, are you ready to work with me on this?
Certainly.
Excellent. Why don't I let you take care of the overview and we'll go sort of slide by slide.
Sure. The purpose of our claims subwork group is to focus primarily on the business processes and the challenges related to workflow for both encounters and fee-for-service claims. We're trying to promote adoption of electronic transactions for these FFS and encounter transactions, and also address how implementations can be facilitated. We provide a forum to address business issues related to implementation and use of the claim transactions. One of the things that I particularly enjoy in working with this group is the collaborative nature of all the participants. It seems like every a topic we get into, someone brings another perspective to the table, a new experience, examples of issues and difficulties that have had to have been overcome. And I think that gives all of us a better perspective and walk a mile in someone else's shoes, if you would, across the industry, regardless of what segment you're in, whether you're a vendor, a clearinghouse, a payer, or a provider. The responsibilities of the team include adhering to all of the policies of WEDI. We do monthly report ups to leadership. We do also support the agnostic technology vendor approach. We're trying to come up with what works for the business, not which particular technology is required. Now, traditionally, I'd say that WEDI has focused more in the HIPAA and the X12 arena. And one of the challenges that claims team is looking at is how do we broaden that perspective to address more of the real-time and API considerations that are also currently active in the industry. Another area that the claims team has been active in is working in providing input to CMS and HHS. It was very interesting to me to see that HHS actually reached out to WEDI and had a question, for example, on the use of claim transactions to potentially capture new information or new data. And it was really a pleasant surprise to see that HHS is really relying on WEDI and the expertise of the membership to try to address their future data needs. The goals of our group are to provide a forum for all stakeholders. We want to address the business issues. We know that implementations are a particular challenge, and we like to get together and discuss all aspects of those. As we go through definition of what the issues are facing the industry, we can then produce the educational guidance and best practice recommendations, we hope, related to those business processes. And so that we can all address these industry challenges together as we move forward. Stanley.
Great. Next slide, please. We have provided a number of inputs into the No Surprises Act task group in helping them to define some of the items. What is a convening provider? What do we really mean by someone that has requested a good faith estimate? We are working on conference and summit education, and in some of the working groups. We've developed and now published a good faith estimate use case paper that's available at the WEDI website. Again, helping to establish a couple of use cases that people can use to develop approaches to solving the issues involved in the good faith estimate. Next slide, please. And Chuck, let's talk about what we're working on right now. Chuck, want to do this?
Sorry, technical difficulty there.
Okay, go ahead.
Sure. One of the items the group's currently working on is a paper addressing the lessons learned from previous transitions. We know that several of the NPRM's national proposed rulemaking documents have referenced different versions of for example, the X12 standards. And in the past, migration to, for example, 5010 from 4010 was quite a challenge. So we're trying to pull together information about past migrations of that type so that we can take a look at what has happened in the past and how do we better plan for the future so that we can do it more effectively and hopefully more easily. So we're working on the lessons learned paper with a particular focus, if you would, on what are the elements associated with migrations and how do we convey a very succinct but supportive document, if you would, in terms of an executive summary, so that if someone doesn't have a lot of time to read all of the documentation we're assembling, they can at least see the breadth and depth from the summary so that they are aware of all of the topics associated with migration, such as from one X12 standard to another. Through the work on the lessons learned paper, we're identifying issues that are probably going to contribute to cost, whether that's research, training, testing, coordination, communications, and then we are going to move on to what are the costs and the benefits of moving from, for example, the 5010 standard to the 80 next standard. Stanley?
Right, and I think it's important in both these papers that we not only try to understand the problem, but we come up with recommendations for resolving some of those problems. For example, we know that the NCVHS and CMS are considering moving to the next version of the X12 standard for the standard HIPAA transactions. What would we like to see in the rule to help ease that transition, whether it's a longer time frame, shorter time frame, allowing for dual or multiple versions at the same time, setting different time frames for different parts of the industry. So we're looking at issues like that, hopefully to advise the government as the best way to handle that. And again, the cost versus benefits of moving to the next version, again, as an aid to the government and hopefully supporting the reasons for doing that. Michael, you said we have a question in the chat?
Hi, Stanley. Yes, from Sue Owen. Can you also evaluate that the change is worth the cost of implementation? I give the cost of adding CLM 052 in the 837P that literally had no value add.
Yes, that is one of the things that we're working on, the cost versus the benefits in that paper. We'll try and break it down issue by issue, but it is really implementing the new version as a whole. And in a recent meeting, I understand several of the WEDI work groups may be beginning to do this in partnership with X12. So perhaps that work group will even mention that. But there is some ideas that we will work with X12 to help better define the costs and the benefits of making those changes.
Yes, also, Stanley, Sue, the concern that is also going to be addressed by the group is how do we put forward a return on investment, if you would, financial justification for these changes. So the costs associated with these changes needs to be identified, and then the rationale for moving forward, such as the point you're making. What are the benefits that do accrue to a return on investment? So please join us in that work. Thank you.
Great. Next slide, please. We meet twice a month, second and the fourth Thursday at 11 a.m. Once again, if you are a WEDI member, you can contact Samantha Holvey to join our work group. I think, as a reminder, as mentioned a couple of times, one of the benefits of WEDI membership is the ability to participate in these work groups, and both, I want to say in my years working with WEDI, there's really a two-way street here. Not only do you get to participate in coming up with recommendations and suggestions for the industry, but you also learn a lot from the other folks that are on the work group, better things to do for your particular organization. So again, I urge anybody that's a WEDI member to join one of the work groups in your area of interest. And if you're not a WEDI member, consider membership in the organization. That's it for us. Chuck?
One final point, please join us next week at 10:30 during the spring conference, when we'll be having our regular meeting from 10:30 to 11 o'clock. It'll be an abbreviated meeting to an extent, but we will be, you would have the opportunity to see the group in action.
Oh, that's right. And that's for anybody that's attending the conference. You don't need to be a WEDI member to join that special meeting. So thanks, Chuck.
You bet. Thank you, everyone.
Thanks, Chuck and Stanley. And now we'll turn it over to Amanda and Donna for the Eligibility and Benefits subwork group.
Hi, my name is Donna Campbell. I work for Blue Cross Blue Shield of Illinois. I am a co-chair of the subwork group with Amanda Abbott, who is from Blue Cross Blue Shield of Kansas. We have been partnering together as a couple of co-chairs for about a year now. Prior to that, we had Deb McCachran, who was our co-chair, and she has retired. So Amanda is filling that spot quite nicely. Can we move to the next slide? Much like many of the other subwork groups, we have similar focuses, except on different scope. Our scope is primarily the eligibility and benefit transaction and workflow that's exchanged between the different stakeholders that fall within the EMB world, which are providers and payers, clearinghouse vendors, and to some extent, the providers that are also vendors in the cases of MD Live and telehealth type providers that offer those services. We always assist with implementation constructs for the 5010, 270, 271 transactions. It's not our only focus. We try to keep the 270 format kind of separate from the scope of the discussions, but when we are challenged with implementation questions when it comes to business practices, we are always open to discussing and advising through our group what we think is best practice. We, as you see in the next bullet, do a lot of that discussion about current state and what would be beneficial to either workarounds or current state challenges that may dictate a need for maintenance requests, and then walk through and talk through how some of those ROIs would come. And then we would also heavily push to ensure that people are supporting the 5010 X279A1 format of the 270, 271. It's quite surprising to hear still years and years later that there are still some who exchange the 4010 transaction, albeit legitimately with clearinghouses and vendors who upconvert, but it really, really lacks some of the big bang in some of those functionalities that have been offered through 5010. So we try to encourage as much as possible the recommendation to move off of 4010 if there still are people on 4010 move over to 5010 so they can get a lot more of that capability structure. Next slide, please. Much like the other groups, as we mentioned, we have a couple items that are in our scope that cross all work groups and sub-work groups. That's our policies and procedures that we must adhere to, reporting to our work group leadership, the data exchange leadership, and making sure that we share with them what our focuses are, being absolutely antitrust supportive and making sure that we're not trying to pitch or sell anything. We want to be technology and vendor agnostic. And then we try to do anything that WEDI wants us to do or we want to participate in from a WEDI activity with respect to anything related to CMS and HHS to further the adoption of future transactions and adherence and accommodation to any of the structural requirements as well as any of the business needs that may not be satisfied right now that could be in the future. Most of our work group meetings are around the business issues that we have with respect to current state 270, 271 and or eligibility and benefit exchanges. We will try our best to try to accommodate like workarounds and see if there's a business workaround that we can address and or if there's best practices and people have certain solutions that they've already done, share those solutions with as much of the removal of business confidential information as possible, and then try to encourage people to bring forward those change requests to adopt those accommodations for those future versions that fall within those standard development organizations that build those transactions. Next slide. Some of the items that we're working on in our work group, our sub-work group are, we just completed phase 1, we're calling it phase 1 of our tiered benefits issue brief. It's essentially a best practice paper, not so much a did you know, on how to expect to get better benefit information if you have tiering in a payer system for providers. So we've come up with a first phase of the paper that has to do with specifically provider tiering. And with that, that paper is going through some approval processes now, and we'll come back to the sub-work group with any modifications that might need to be made. Once that's done, we anticipate in the next 2, 3, 4 weeks, we will have a final phase 1 issue brief that will be out there for the tiered benefits. And then with that, we are rolling into what we want to work on next, being that we finish the phase 1, assuming that nothing is outstanding and or critical to correct. We anticipate potentially looking at whether or not we want to do a phase 2 of the paper, which means we would get into different type of dynamics that have to do with tier benefits that may or may not be related to the provider tiering, but might be coupled with something else like product tiering. We are also pitching to see if there's any other ideas outside of the ones you see on this slide. But what we put out there was a survey to find out if we wanted to resurface the resurrect the reasons for calling homework that we had started doing, which was going to soon after that turn into possibly a did you know or an issue brief or a white paper. We would not know until we had more of the material captured on why we're having payers report that although they have, you know, upwards of 2 million, 3 million eligibility and benefit inquiries through the 270, 271 or other portal-like exchanges, that they're still getting phone calls. So we wanted to get down to how could we take some of that valuable information on the reasons why those phone calls are still happening in light of the large number and large volume of 270, 271 transactions that payers are getting, and try to figure out if it's a gap in the transaction that we would approach X12 to make changes with, and or if it's just misunderstanding or misinterpretation, which may or may not still include the standard development organization X12 to help resolve or interpret, or if it's a business workflow issue and it's just a matter of helping course correct, if possible, what's going on. Another opportunity that was explored and is still being explored is working with the No Surprises Act and the use of potentially the EMB 270, 271 to promote some of those estimates, so to speak, or the cost share that the member may be on point for. This would obviously be in collaboration with the No Surprises Act work group. We are talking about whether or not there's benefit to talk about what is the 270, 271 lacking, what do we know is missing that hasn't been accommodated in future versions that have been either in the works or even finalized through the standard development maintenance process, and whether or not our WEDI work group would like to submit either on behalf of WEDI or as a collaborative, submit requests to adjust and modify the 270, 271 for the future. We're also looking at the potential of addressing a best practices paper for how to handle eligibility and benefit responses when you might be quoting on something that is retroactively been canceled. They're inactive after you've already, basically it's a timing issue, and whether or not we can come up with some good best practices on how to handle those retroactive, after the fact inactive cancels. And then there was also a topic that was discussed on the pre-service 270, 271 being on a potential different version than the post-service 837 and 835s. If everything goes forward as we think or could hope, if the 837, 835 are named in 820, 8020, and then say the 270, 271 is named in 8050 or 8060, will that actually cause a problem with implementation when they're on different versions? There was a suggestion that maybe we would want to consider looking at that. Obviously, that, and then potentially the NSA one and a few of the other ones that have dependencies on other transactions that are outside of the 270, 271 will have complete interdependency on whether or not those are named for the future versions and move forward to a final rule. And then there was one other one that came in during the survey that's not on the slide because we created the slide prior to it, which was coming up with a way to do digital ID card images and or QR codes in the 271 to alleviate potentially the mismatch between a member having an old ID card or not having an ID card at all, and having the most current information returned that matches the data that would be on the 271 itself. That was a maintenance request that has been put forth to X12 to see if they can accommodate a digital image of some sort in the 271 in future versions. So while it's not on this paper, that's another one that is up for grabs if we want to work on that after X12 has potentially built out the capability to support that. Next slide, please. Our meeting date and time is the third Wednesday at 1 p.m. Central, 2 p.m. Eastern. We usually put an agenda out the day before or the day of, and next week, we typically would have had a meeting this week, but because of the spring conference next week and this open house today, we canceled it. So the next meeting will be that third Wednesday in June, and we will likely be reviewing again the survey results and then picking our next project or two for the remainder of 2023 and potentially rolling a little bit into 2024 with those that attend. Just like everybody else, we encourage everybody to participate and hope to hear your voice on the line and hope to hear you next week. We will not be doing a sub-work group meeting during the spring conference next week. So we will again wrap up and reach around again in June. Amanda, if you have anything to chime in with, feel free before we turn it back to Pam.
Oh, I just appreciate you, Donna. As you can tell, Donna is very knowledgeable and has a lot to say about eligibility and benefits. And I've learned a lot in the past year or so being her co-chair, and hope to have as much expertise as she does. I've learned so much. So please join us. We would love to hear your voice. Thank you.
You don't know how many people probably laughed when you said she has a lot to say, because you could have just put the period then and ended it.
It was meant to be a compliment. I think you are amazing. So thank you.
There's
so
a
much.
lot of people that know me though, so they know. They know me. Thank you.
Thanks, Donna and Amanda. I'm just not going to comment on that at all and just move along. Excuse me. And one thing I do want to point out that Donna kind of touched on is the variety of work products that our work groups and sub-work groups produce. So while you may think, oh, you know, how boring, we just work on papers all the time, that's not actually the case. We have a really wide variety of types of work products that our work groups produce, and that it can include papers of varying lengths. It might be a a 50-page long paper that's very in-depth, but we also have single-page fact sheets that are very brief and right to the point. We have did you know papers, which are also like FAQs, so they're also very brief. But then we also have work products that are not papers. So we do podcasts, we do spotlights, we participate in the conference sessions. We have a lot of our work groups that do presentations as part of their work group session and then record those. So those are available on our forum and also our YouTube channel. We have a work group that's done some YouTube videos to put on our YouTube channel. We have a wide variety of ways that we can present information to try and reach the widest possible audience. So I just wanted to make sure that everybody knows it's not just about, oh, we're going to sit and talk about making a paper, because that's not what it's always about. We try to share information in a variety of ways so that different people hear things different ways, and we want to be able to support that. So now I'll hand it over to Michelle to talk about the provider information subwork group.
Thank you, Pam. And that was a great way to talk about or to start provider information. Our provider information subwork group is really geared around all of us. If you think about it this way, how many of us have actually been on the end as a consumer of healthcare looking for the right provider at the right time? And then you find the provider, you look at the provider information, you reach out to that particular practitioner, brick and mortar, or even atypical providers to service your particular needs, all to find out that that phone number is no longer in service, and or the service location doesn't accept new patients at this time. So if you think about provider information, not just from a directory, because it's not just for directories anymore, we're talking credentialing, provider enrollment. We're also talking about contracting and networking. And again, provider information leads the patient to the right medical professional to service their needs at the right time. So again, having that information flowing so that consumers, beneficiaries can find the particular provider, that's what we do. And Pam said it so well. We are really focused on bringing the industry together. Some of our work products, if you could go to the next slide, Michael. Thank you. Our purpose and intent is to bring the industry together, really discuss what are the provider information pain points as actors in the healthcare market space from a technology or from a business perspective. You are the experts, and Provider Information Subwork Group would love to have you as an expert to join us in helping making some of these use case decisions. So again, our purpose and intent is really to focus on bringing everybody together, solving for those provider inaccurate data issues, for instance, or driving the right level of credentialing information when needed so that the provider has everything that they need. And again, this is where we collaborate. We've got clearinghouses, vendors, tightly coupled training partners. We've got health plan experts. We've also got individuals as coming in and contributing. We also have member-facing technology organizations who have joined us on this journey regarding provider information. So our intent and purpose here is to drive that collaborative participation, decision-making, stakeholder, I put my stamp on it. We believe in this. It's not just about provider directories, it's provider information around the healthcare marketplace. Our scoped effort is always bringing the industry together. Typically, we have brought panels together like NCQA and URAC to really talk about that certification and recertification, the standards, and how health plans and providers have to generally certify and recertify. So again, we had that panel discussion. It brought us great participation from across the healthcare marketplace. We also talk about all lines of business. It's not just Medicare Advantage or Medicaid. We really talk about how provider information spans across all lines of business. So again, just, think about that as you take this information back and see if this is a great opportunity for you and team, or you specifically, or someone within your organization to join Provider Information Subwork Group and offer the opportunity to have your voice heard. Last but not least, we do respond to RFIs. We did have one, as everybody is aware, around the National Directory Hub. So from a WEDI participation perspective, we pulled together the industry participating individuals around provider information and this RFI. And as we all know, it was out there for 60 days. It came out in October of 2022. Closed on December 6, 2022. You can go out to the Federal Register. I'm going to put the link in the chat, and you can see how WEDI and the membership responded to this particular RFI around provider information and the National Directory Hub. So we get involved at that level. We also take information, then we share general aspects of what is important. How can we continue to work with other subwork groups at WEDI, and then work with standards organization like HL7X12 and pull provider information into their discussions and decision-making processes. So again, if you think about it from a federal, local, and state perspective, we're engaged at that level. So Michael, if you could go to the next slide. Some of our work products that we are hopeful to really have some engagement from you, and we need you as an expert to come in and lend your thought leadership in some of the processes and some of the new opportunities that we're trying to put together. And of course, we are meeting this coming week. So if you're interested, feel free to register if you haven't already registered for the Provider Information Subwork Group meeting. But we are meeting next week while we have our 2023 WEDI virtual session, spring session. So again, you get to see the interaction, the engagement, and we talk about how do we effectively demonstrate the importance of provider information on a claim, on an actual authorization, or a notification, a certification, which is a part of the 278 transaction. So if you think about all of this level of information and exchange of data, we are engaged as many subwork groups as we can. So again, provider information pretty much touches everything that is tied to a member or a subscriber, consumer, beneficiary. And so again, just wanted to make sure from a purpose and scope perspective that you got to understand that our current work products aren't just focused on writing papers. We are focused on engaging the industry and really being that thought leader. Use cases are something the work group is going to talk about and really put into action. 2023 as well as 2024. It's going to be around credentialing and provider information, provider directories. What is important in a provider directory moving forward? So also present the opportunity, if we are afforded the opportunity, to HHS and ONC as to our industry recommendation for directories. And then you always hear the term norming, storming, and forming. So as people come in and out of our subwork group, there are alternative work products that we are looking at. We continue to deliver podcasts. We have not had an opportunity to do one as of yet this year, but we do have it scheduled for third quarter of 2023. We also are participating and hopefully having speaking opportunities at HL7X12, Cooperative Exchange, so other industry organizations, HIMSS, MGMA. So again, we're really trying to engage in the industry. And then the other thing we talked about, and Pam did such a great job also bringing out, is if you haven't joined our YouTube, please join the WEDI YouTube channel. There is going to be more additional information around provider information. It may not be a picture of an individual, but it's going to be work products that we're going to share from a video perspective that ultimately will drive more participation and your compassion around making change happen. So again, would love to have you participate this week. If you haven't already registered, I'm hopeful that there are still opportunities for you to register for the Provider Information Subwork Group meeting. The next slide, Michael, if you could take us, and we've already talked about current. Just want to make sure that everybody understands a couple of other things that are near and passionate to this work group is not only looking at transmitting data, but how you transmit the data, how often, timeliness, is it real time versus batch? Do you also transmit and validate the accuracy of the data? So again, accuracy of data, it seems to be one of the highest points for our provider information subwork group team. And we're trying to figure out, putting some actual use cases behind what we would consider data accuracy. So again, just be on the lookout for some of this additional information that's going to be coming through either YouTube channel and or a paper or an educational form of speaking engagement. And again, we're also looking at bringing other individuals and organizations into explaining how they transmit data. Some of the other conversations have been around blockchain. Also, gender has been a huge topic around provider information. So just so everybody's aware, we also have a Colorado mandate that is requiring gender types in a provider directory. So the providers have to identify their gender type. So there's more to it than just looking at name. Is it a licensed name? Is it an actual nickname that this provider is known by versus birth name? So there's a lot of complexities behind what we're looking at, and research. There is a lot of research. So if you have that dedicated research skill set, we would love to have you join the team. Provider enrollment into a particular health plan is also something we're looking at, not provider EDI enrollment, which is also known as the 838 X12 transaction, but we're really looking at that contractual enrollment opportunity, which drives contracts and networking. So again, as you can see on the slide here, we've been pretty active and we continue to stay active. The last slide that we have is sharing our regular work group meetings meet every second Wednesday from 3 to 4 p.m. Eastern. Again, our next actual standing meeting will be June the 14th, but we are meeting next week. So we canceled our meeting earlier in the month to have everybody join us, or anyone and everyone who's interested in joining us during the 2023 WEDI spring session. So I am going to put the URL in the chat for the NDH RFI and want to turn it back over to Pam. Thank you, everyone.
Great. Thanks, Michelle. Now we'll turn it over to Rosalind for the Genomics work group.
Well, hi, everybody there. I thought my computer's functioning very slow, of course, because I want to be on camera for everything. But I'm Rosalind Ryan. I work with HealthFox. I am the current chair of the Genomics work group because we're in the process of getting another chair, and then we'll all be coaching. The two of us will be co-chairs together. So if we go over the purpose of this work group, really we're looking at everything having to do with genomics right now. And for those of you that don't know, genomics has been in practice throughout medicine probably for over 70 years. What has changed in the last little bit, though, is the cost of doing sequencing and the type of information that's available for analyzing those results has made a drastic turn. The costs have gone down, the information and resources to analyze have gone up, and as a result of this, all of the different facets of genomics are much more accessible to healthcare than they've ever been at any time previously. So we're kind of taking on the role that says right now, because it's eminently going to be a part of more and more practices, more and more payment structures, we really need to function as an education tool so that people can start to understand different parameters, start to understand different issues, because it is such a fast-moving and widely divergent field if we don't stop to take a look at what comprises it and what kinds of things we could make a difference in, we won't be as effective as we could. So this is giving us a good chance to do that. So we really look to be able to do that by bringing in subject matter experts in different areas. And we also are going to be taking a look at the adoption of electronic transactions in genomics. Right now, it tends to be a little bit outside of mainstream, and we're working hard with members of the legislature, members of policy, members of other different organizations to make sure that we get this transaction information correct and safe and in the hands of those people that need it to make better decisions. In terms of scope, we're really looking at being a forum for all the stakeholders to address business issues. When it comes down to it, genomics has tremendous power to save costs, to reduce wait times for people that are waiting for treatments to work by getting the treatments correct. And I would say probably its biggest impact is to work on preventative, to allow people to either catch disease before it presents or in very early stages of presenting, so that we can do the most we can to get it under control and get the patients the right resources at the right time. So one of the other things that we're doing is really looking at best practices. There are a number of health systems and providers around the country who have implemented genomics programs. Some of them choose to start out big and want to do everything at once. Some of them choose to go into it a little bit at a time, kind of getting their feet wet, understanding how it's going to be, and then making plans for scaling up. So we want to be able to address the needs of all these different types of organizations with real expertise that has done this before and can share their thought leadership and subject matter expertise with other people. Next slide. So in terms of recent work products, we are very much on the side of creating informational, sometimes YouTube videos, sometimes presentations from experts in the field from different areas. So just as an example, we've had an amazing pharmacogenomics presentation that really talked about how you can use genetic information to make the right decision about getting the right medication to the patient the first time. So it eliminates a lot of the guesswork. It eliminates a lot of trying to figure out if a drug is going to be effective. We can sometimes know those kinds of things ahead of time and then work to make sure the patient is able to metabolize and get the most benefit from that drug. We also have had speakers from the Global Alliance for Genomic Health, which is a worldwide standards organization that not only works to create the standards for genomic information and genomic data, but also does a great job of sharing worldwide views. So there are many countries that are far advanced in front of the US in terms of actually implementing genomics. We can learn from them. There are other countries that are just starting to get into it in different areas. And so we can work with them so that we've got more resources addressing these kinds of problems. They did a fantastic job about talking about the organization and what it is and what it's doing to further work in the genomics area. And we had another presentation by a group out of Harvard that is called Genomes 2 People. And right now they've got 2 huge sequencing projects going on. One of them, as you can see by this picture, is newborn sequencing, which really has the power to deliver some spot-on information that will make it easier to identify potential disease or problems before they actually present themselves in the infant, so that we can take action and do something about it. They also have a separate panel that they're working on, which I think is clever. They call it Apparently Healthy Adults. And the reason it's apparent is because they're able to identify things before they present and be able to understand if there are proactive things that we can do in terms of understanding genetic mutations and sort of get a leg up on disease that might present itself. All fascinating, all at the beginning of their life cycle and moving towards greater and greater implementation as this becomes more of a science accessible to all payers and providers. So that's a great thing. Next slide. So what we're currently working on is understanding the genomic workflows for all stakeholders. You know, obviously this is not a mainstream that everybody has, and everybody has worked on the processes for implementing that. So we really have to start at the beginning to understand what would a workflow look like? How do we implement it? What resources and tools, what stakeholders? We are also definitely looking at how we can better assist HHS with their needs regarding genomics. You know, they're in kind of the same position that we are, where at this point, the best thing that we can do is educate people and let them know what's going on and let them know the value of these kinds of things. So we plan on being able to work with other members of the WEDI organization to give HHS the benefit of the knowledge and education that we're producing. The next thing that we're working on, and a lot of this is through my work in genomics, is providing a framework for aligning with other associations for the common purpose of getting more genomics use ethically. I am a part of GA4GH. I do work on their regulatory and compliance work group. So there will be a definite overlap of things that we could do together to help promote genomics use. I also was recently appointed the chair of HIMSS Genomic Work Group, and that will give us another very large organization to partner with in this area. And we are really working on building a team of work group members that want to work on interesting genomic issues. And because so much of this is based on education and on gathering data and gathering results, you don't need to be a genomics expert to join our work group. We are especially looking for people who are interested in learning more, because they will bring fresh ideas to this segment. And maybe we won't have to go through a lot of the same tedious processes for implementation that are often a part of our healthcare workflow process. So that's a good thing that we're looking for. Next. So we meet the 4th Tuesday of every month. We're kind of bringing up the rear around that. And it's 1 p.m. Eastern. And like I said, our meetings are at this point mostly educational. We're bringing in phenomenal speakers that have experience in very specific aspects of genomics so that people can get the better lay of the land. And we're probably anticipating that sometime later this year, we will shift into actually other types of engagement, possibly writing papers, possibly doing research, possibly exploring with other parties and associations about the things that they're doing to promote genomics and joining with them. So we're looking for new people. We definitely want people who are inquisitive and interested and willing to approach new and novel things in different ways. So if that sounds like you, come join us. Thank you.
Thanks, Rosalind. And now the Remittance Advice and Payments Subwork Group, the co-chairs are Pat Wietek and also myself. So Pat's going to go first. I'll turn it over to her.
Hi, can you hear me now? I'm trying
Yes.
to unmute.
Yes, I can hear
Okay,
you.
thank you. I double mute. Okay, thanks. Thanks for having us today. The payment, remittance advice payment subwork groups, what's our purpose? We focus primarily on healthcare business processes and challenges related to payments and the remittance advice, which most of us know is the 835 transaction, as well as promote adoption of those electronic transactions. What's our scope? Besides adhering to our WEDI policies and procedures, and we report to our leadership, our status of what we're doing in our monthly meetings. We are also technology and vendor solution agnostic. That's very important, I think, for us because of all the different entities that are involved when you talk about healthcare claim payments. Our goals. We provide a forum for all those stakeholders to address their business issues and anything related to the remittance advice and payments. So, we also don't just talk about paying transactions, but we do try to get into just other kinds of payments as well. And then we provide educational guidance and best practices, for an example, through white papers. They're related to issues for business processes and challenges of the remittance advice and payments. And we also participate in WEDI's activities that would provide input to CMS and HHS as appropriate. And I'll hand it back to Pam.
Great, thanks. Next slide, please. There we go. So our work group has been in existence for a pretty long time. We have a good laundry list of work products that we've produced over time. But we try to touch on a variety of subjects, not just focusing on the remittance advice, but focusing on the payment as well. So we've just recently updated the paper that WEDI produced on the guiding principles for electronic payments. We've created a paper on remittances that are sent to providers from business associates of the health plan. We've done a paper and had conference sessions on updates to the NACHA operating rules, which regulate the payments that are made. We've done surveys for fees on EFT, and that was done at the request of CMS. We have a paper that covers all different aspects of the usage of the PLB segment with multiple appendices, and then conference sessions on that. We've provided comments to the No Surprises Act task group on the QPA and its use in the 835 transaction, paper on payments sent to incorrect entities, and we've even done a Remittance Advice and Payments 101 webinar, which is available on our YouTube channel. So we have a wide variety. All of these papers should be available on the WEDI forum, or I'm sorry, the WEDI Knowledge Center, and then, of course, the recordings of the conference sessions as well. Next slide, please. So currently, we're taking a look at what are some of the major changes that are happening in the remittance advice transaction as we move from our current version of 5010 to the newer version. And this is a joint project that we're working on with X12. So we're working in collaboration with X12, creating a series of fact sheets. So we want these to be hopefully a single page, very short documents, highlighting some major features of some of the updates that are being made and just really high level information about things like the RAS segment, updates to the PLB segment, updates to the overpayment recovery process, new remark code lists and new ways to report remark codes, and a whole new loop that exists in the 835. So we picked out some of the major changes that were happening within the new version of the transaction, and then are creating these fact sheets to give just a single page on, hey, here's some things you need to pay attention to as you look at the new version, and as we continue to look at moving it forward. So this is ongoing, but we will be sharing a little bit more information about these in the coffee kickoff that's happening at the conference on Wednesday morning. So tune in Wednesday morning to get just a little bit more detail on some of these. And next slide, please. We regularly meet on the first and third Monday at 11 Eastern. We are meeting this coming Monday in conjunction with the conference, also at 11 Eastern. So if you would care to join us, you can tune in and get a feel for what we do as a work group. While we are in the process of doing, I didn't mention this, but while we're in the process of doing these fact sheets and working with X12 on that information, we are simultaneously taking a look at a previous paper that we had written on enrollments for both the ERA transactions as well as the EFT payments. So we're refreshing an enrollment paper simultaneously while we're looking at the updates, the fact sheet papers. So that's what we'll be doing on Monday when we hold our work group session, and we hope that everyone can join us. Pat, anything to throw in? I guess that's it.
Sorry. No, I had that mute thing going on.
Sorry.
No, that's it. Nope, that's it. We are such a busy group. We're overachievers, as we like to say.
We are overachievers, and we're very prolific. We produce a lot of information. We address a lot of topics, and we have really good discussion in our work groups, and we have a really good representation of stakeholders. We have both providers and payers as well as vendors in our group. So we have a really good representation of stakeholders.
Yeah, and clearinghouses. Don't forget them.
Yes, clearinghouses and CMS participates as well.
Yes.
So, okay, next slide, please. So now we will hand it off to the telehealth work group with Jill and Nancy.
Thanks, Pam. I believe Nancy is listening, but she's not able to present today, so I will present and speak for the both of us. I am Jill Dominic. I am an associate at Elevance Health, newly named Elevance Health, formerly Anthem, and Nancy is with the American Medical Association. So Nancy could give you a better overview of the history of the telehealth work group. I've been in a co-chair for about 1.5 years, and I came in as co-chair, so I don't have the extensive history that she does, and certainly have been a lot of changes in telehealth over the last few years. But I can tell you what our purpose is and our scope. So the purpose of the telehealth work group is threefold. We focus primarily on business processes and challenges related to workflow, related to telehealth and the exchange of data for telehealth services. We evaluate business cases, return on investment, data exchange, and just, the overall functions of telehealth services in the healthcare system. Like many other work groups who have spoken today, we like to, we do consider the perspectives of many different types of stakeholders, as our work group is made up of different stakeholders. We have providers, payers, vendors, and we even try and focus on the patient perspective as well in the various components that make up the delivery of telehealth services. So the scope of our work group, as I said, is business cases, return on investment, data exchange, and overall functions of telehealth services as it relates or as in today's healthcare system. So our recent work products, Nancy did a great job of developing a fact sheet, and it details the Medicare telehealth changes that are coming after the PHE. As you all know, that ended at midnight on May 11th. So a lot of the Medicare flexibilities are continuing through the end of telehealth flexibilities are continued through the end of 2024, but there are some that changed with the end of the PHE and still others that are changing at different times between now and the end of 2024. So that fact sheet came at a good time right before the PHE ended. We did a paper last fall, which talks about integrating telehealth data from telehealth standalone platforms into the EHR. And, the challenges that can come with that, both for doctors who have a hybrid model and for a standalone telehealth platform, how that data gets into the patient's EHR and problems that can occur if it doesn't happen. We recently started a series called Telehealth Reflections. And so we've recorded 2 parts so far, just recording the experiences that patients have in accessing telehealth services. So it could be good or bad. And many of our WEDI colleagues were generous enough to participate in these reflections and share their experiences, as well as Nancy and I. So we also had a presentation at our last meeting, and it was my colleague from Carolina Behavioral Health, which is under Elevance Health. And he gave a lot of great information about telehealth's evolutionary path as it relates to behavioral health. So he shared a lot of where it's been and where it's going. And so we appreciated that. And we've talked about trying to move away from just talking amongst ourselves at our work group meetings each month and trying to bring on presenters that can share topics during our meetings. We also hosted a very informative spotlight event last fall, the value and future of telehealth. We had some great speakers from ATA and Cherokee Nation and Zoom, among others. So a lot of great information was shared during that. So we're currently working on, as I talked about, we have our telehealth reflection series. We'd like to add more. So we're looking for more volunteers who can discuss experiences they've had with telehealth, and we'll keep that as a running series. And then, as I said before, we're also looking for presenters for future meetings. We canceled our May meeting because of this conference, but we'll be meeting again starting in June, and we'll be looking for speakers that can come in and kind of spice up our meetings. We do meet on the 4th Wednesday of each month at 2 p.m. Eastern. Thank you.
Great, thanks, Jill.
Sure.
And now I'll turn it over to Andrew for our claim status group. I believe you're bringing up the rear here.
No, you could say that's either the fortunate or unfortunate. That means I can take up 3 more minutes over my allotted time. No, I'll be brief. Thanks for giving me the opportunity to speak to the group today. I am new to WEDI in the last 1.5 years. And I'm excited to be focused on the claim status transaction. Again, similar to other groups, this is really focused on increasing adoption, understanding the barriers, gathering intelligence, and providing educational materials, very similar to other groups in terms of our mission. Next slide, please. So what we've been working on, again, since I started, just really getting my feet wet with working with what has become a diverse group of constituents, which is great, from provider to clearinghouse to payer. I heard a lot of the same from a lot of the other groups. So it's been good to get everyone's particular perspective. What we, I think, came to conclusions is that adoption, while increasing on the availability side on both payer and provider, hasn't really kept up in terms of actual volume. So while there's some availability, the transaction's not being utilized as much as we think it could be. And so we've spent a lot of time really identifying those core challenges that are preventing further adoption. These can vary from, availability of the transaction to just not being able to find the actual claim on file at the payer. There's challenges with content, variation, implementation hurdles as well. Being able to have it be a priority for the provider to implement can be a challenge. And there's also sometimes different types of connectivity variances. All this to say, these are a combination of challenges that we think really are contributing to adoption that, we're really starting to now think, well, what can we do to try and help the industry overcome these challenges, right? Similar to other work groups. So where we are right now is really looking at a number of options. One, and I've seen, again, it's been useful actually to be last because I've got to learn a lot about how other groups have sort of gone through time with their different work products, but certainly a best practices guide to help in both the provider, payer, and clearinghouses' ability to implement, right? Because how the transaction is implemented can lead to varying degrees of adoption from all constituents. And then we think as an initial foray into communicating what's going on in the industry is really just a fact sheet, just to really prime the industry with what's the real use case for claim status, what are some of the core challenges, and what are some short-term / long-term potential solutions. So again, really getting ourselves started. It's been great to have a variety of payers, providers, and clearinghouses attend the meetings on a regular basis. So I appreciate those that are attending. Next slide, please. I promised I'd be brief, and I have been, but we are the first Monday of every month at 1 p.m. Eastern if you'd like to join. So I think sometimes if you're at the end, it's good to be brief. I noticed there still are a number of folks still here, so I appreciate you hanging on for the rear end of the presentations here today. Thank you.
Thanks, Andrew. So again, thank you for joining us. Thanks for hanging on till the end. I know we've presented a lot of information to you. You can see we've got such a wide variety of work groups and such a large amount of work that's being done within these work groups. And we just encourage you all to participate. Hopefully you heard something today that really piques your interest, and would encourage you to join that group and just feel it out, see how it works for you. I also would like to make sure that you're aware that as a WEDI member, not just you, but anyone in your organization is open to participate in any of our work groups. So if you have someone that really has a lot of expertise in claim status, then maybe pull them in to join Andrew's group. If you have a privacy and security expert, pull them into our privacy and security group. Anyone in your organization can attend. There's no limit to the amount of attendance that you have. So again, we encourage everyone to join our work groups. Here's information about where to go to get more information in our work group community. And you can always contact Sam Holvey as well to get more information. Michael, any other questions in the chat?
No other questions. Thank you all very much. And once again, next week is WEDI's annual spring conference. So find out more from our work groups, as well as fantastic content from fantastic subject matter experts throughout all of health IT.
Great. Well, then we will close out. Thank you, everyone, for attending. And reminder that the slides and the recording will be emailed out, so you will have this information to review again at a later time, and hopefully share within your organization so you can encourage more people to participate in our work groups. Thank you all very much.